You want me to?
Hi, this is Twila Braze, Citizens Council for Health Freedom, and I am here talking with Dr. Dewey Lane, a former surgeon, about what it was like to deal with patients who were poor before we had Medicaid. Dr. Lane, would you like to describe what it was like?
Well, the situation was that many of the patients that we were working with as a surgeon couldn't pay anything like the normal fee. And so the reality was that we treated them like anybody else, and instead of marking them as charity patients, we would reduce the fee down to a minimal amount, but let it be paid over a long period of time so that they would know that they were not charity, but they were private paying patients. And then that way they were free to come back as need be to get proper care for their families. And so we enjoyed that and learned that that's really the idea of absence of insurance does not mean absence of care.
Now, that's such an important concept. The absence of insurance does not mean absence of care.
And this is true because in the medical community where I was practicing, the hospital was very cooperative. And if I called over and said I had a patient that needed to have a particular operation, but he can't pay, and they said, well, are you charging? And we'll say, no, we're reducing our fee also, and told them what we're doing. And they would have automatically let the patient come on in and got the same care. So it was so much better from the standpoint of the patient feeling not pushed down into a category of being a charity patient.
Not stigmatized.
That's right.
They felt cared for just like any other one of your patients who was a paying patient.
Sure, and they were. And they were respected for what they were and under the circumstances, and they may or may not have known that what the fee normally was.
Right.
We didn't have to tell them. We just tell them what their fee is, and if they'd like to pay it at $10 a month, that would be fine, and they would manage to do that.
And what would you say to what is happening now with charity care and Medicaid? Do you think Medicaid was a better solution than the way that you provided care back then?
It's, of course, a complicated thing, but I don't think it's really better for the patient because of what it does to their self-image. But from the economic standpoint, I'm not sure it's any better either. We had about a 25% of reduction or non-payment of normal fees before Medicaid, and then 35 years later, we found that the percentage was very little changed. It still came out about the same thing, of either non-payment or unable to, or unwilling to pay. And now it became more of an unwillingness rather than inability to pay.
So the question that a lot of listeners might have is, to what degree do you think anybody has ever been refused care as a result of not being able to pay? It doesn't sound like people were refused.
Not in our area. They were not refused care. However, one of the problems is that as the government decided that they were going to be the arbiter and the provider of care, then I'll have to say attitudes of physicians have changed.
I see.
It's become more of a business and less of a sense of a ministry, and so it makes it hard to really say whether they're getting the same care
that they were.
Yeah.
Which I think I may have told you this, but one of the things that we say with our organization is that we're losing the mission of medicine to the business of healthcare. One is warm and friendly, and the other one is cold and more calculated, and I think that's where we have come.
Well, I've heard sitting around in the doctor's lounge anger from physicians who have found interference in their practice by insurance, and whether it be Medicare or Medicaid or private insurance, limiting what they know should be done for the patient. And I've heard the cynical statement, well, we can beat those, whatever you want to call them, and that leads to cutting corners, shaving what you put down as far as the code in order to...
Changing the records a bit.
Yes.
The coding, billing records.
And then once any person compromises their integrity, even in a little area, then there's a lot more of a tendency to do that in bigger and bigger things.
That's correct. Well, thank you so much, Dr. Lane. I really appreciate meeting you here in Nashville, having the opportunity to say your story.
Well,
thank you so much.
Yeah, thank you.
Here we go. We're leaving.